Hello, everybody. This is Dr. Kamel and a new content regarding physical therapy, clinical education, and preparation for physical therapy license exams. My name is Dr. Kamel. I am associate professor of physical therapy in the United States, and also I am a registered licensed physical therapist in a number of states across the US, also in the UK and Egypt. I have got my PhD from University of Nottingham in the UK. So let's go for today's content and see what we'll be talking about. A patient with a history of coronary artery disease is beginning a cardiac rehabilitation program. Prior to initiating exercise training, the physical therapist performs an initial interview. You know, before we start anything, either examination, intervention, or anything, we have to interview the patient, and we need to learn about techniques for interviewing the patient, how we can get information, how we can approach the patient, how we can get consent, how we can have legal and ethical patient interview. Okay. So, which of the following questions should be the therapist ask first? Patient have coronary artery disease, starting cardiac rehabilitation program, and you are interviewing the patient. What question you should ask first? A. Ask the patient to describe the correct aspects of exercise demonstrated by the therapist. Ask the patient to list problems associated with poor nutritional habits. Ask the patient to identify the harmful effects of smoking on cardiac disease. I don't think that the patient is in exam and you're giving the patient some oral questions, some written questions, and you are testing the patient. I don't think so. Ask the patient to describe the type of angina symptoms experience. Angina is a chest pain, and this is a patient of coronary artery disease, and you need to learn about that. So, what is the correct answer? For sure is D. Ask the patient to describe the type of angina symptoms experienced. We know that coronary artery disease is could be partial obstruction of for different degrees in coronary arteries, and it might result in stable angina, unstable angina, different types of problems. Okay, but we need to learn about that. If this angina can be relieved by rest, by taking nitroglycerin, or the pain will not be relieved anyway. So in cardiac rehab, the first priority is patient safety and risk assessment before exercise. 100%. We always aim for patient safety and risk assessment, and it is more important in cardiac rehabilitation. Understanding the type, triggers, and characteristics of angina, because we have different types of angina as we learn in our cardiopulmonary section. We have stable angina, unstable angina, we have brenzimital angina, so we have different types of them. But it will help us to determine exercise tolerance, because I am trying to tailor an exercise prescription for this patient. Okay, so I need to understand how far the patient can go. Okay, we have what's called an angina threshold. We learn about it. So exercise tolerance, safe intensity levels. When we prescribe exercise, intensity is one of the main factors we take into consideration. Need for monitoring. What I mean by monitoring: monitoring of heart rate, monitoring of ECG, monitoring of blood pressure, vitals in general. Risk of ischemia during activity. Any signs or symptoms for ischemia happening after how long time of exercise, after how many repetitions, after we need to learn about that. Knowing whether the patient has a stable angina, unstable angina, or variant or brenzimital angina directly affect exercise prescription and medical safety. Okay, so this is the answer. So, in order to best intervene with a patient who has had cardiac dysfunction, a full examination and evaluation are necessary to properly form a treatment plan. Basics, okay? Common sense. An important aspect of the examination is ascertaining the type of angina that the patient experiences so that the therapist will know how to prevent angina. We never reach to, angina or threshold or go beyond angina threshold with exercise or recognize if it does occur during the treatment session. Okay, so this is the only answer here, which is valuable answer in these four ones. Incorrect answers: exercise demonstration. Teaching exercise techniques occur when? After assessment, right? Not before determining cardiac symptoms. This is the next step, not now. Nutritional habits, yes, nutritional education is important as well, but it is not the immediate priority or the first thing we do. Okay, we need to do exercise testing first, interview the patient, understand about the condition, and then we can do that. Smoking effects, again, smoking, yes, it is one of the risk factors, and we need to help the patient in this risk factor modification. Either we refer the patient to support groups or do whatever we can teach the patient or direct the patient. But again, this is part of the rehabilitation process because we know that cardiopulmonary rehabilitation is not exercise. Yeah, exercise is the main part we do as physical therapists, but we have nutrition, smoking, sedentary lifestyle, functional activities, a lot of stuff we are doing. So, for exam tips or the National Physical Therapy exam tips for cardiac rehab questions, always prioritize safety screening, if there is any safety issues, symptoms, angina, dyspnea, dizziness, vital signs and risk stratification, then education and lifestyle modification. Okay. So this was the answer for today's question. If you would like to join my physical therapy license exam preparation course, please send me a message on WhatsApp number 001442 2487206 or 0020 and I will send you information about how to join the course and everything. If you would like to apply and join the transitional or post-professional DBT program at University of Montana in the US, we can help you to be admitted, but you have to be a graduate of physical therapy program first. It is not for students, as is obvious that. And for the coming semester, the deadline for application is the 31st of March this month. And then the application for the next semester will be starting from April. So now, if you want to join, the next or semester, which is summer 2026, please send us a message on one of these numbers and we will send you the details and you can finish your paperwork as soon as you can. Or if you would like to wait until April and start this paperwork, you will be admitted in the fall 2026, which is a semester after that. Thank you so much for watching my videos, for following my content. And if you do me a favor, by sending the link for your colleagues, either students or graduates, and ask them to join and subscribe, will be much appreciated. Thank you and see you soon in a new content.